We've got Dr. Kevin Kavanagh. He is our retired physician as well as the founder of a national organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
Published report this morning in the Lexington Herald-Leader says Governor Andy Beshear announced 2,250 new cases of COVID-19 in Kentucky on Tuesday, virus-related deaths as the rollout of the vaccine continues across the state. Tuesday's tally of new cases is lower than last Tuesday, which may signal that the spike in the cases following Christmas might be slowing down. If that's true, boy, that is good news, isn't it?
Yes, and I think that is true. And we're seeing that nationally also. Nationally, there is a huge decrease. We had yesterday over 2,700 deaths, which is huge. But the week before, the Monday before, we were looking at over 4,000 deaths. So this is starting to decrease. There is no question that things are headed in the right direction. And we definitely need to continue doing what we're doing, which is wearing masks, socially distance, and be sure to get the vaccine. That is very, very important.
Now, overseas, not to bring up a sore subject, but the strains are very problematic. Is that right? Can you talk about that?
Well, yes, and this is one of the reasons why we need to get the virus under control in this country so that we can start doing effective case tracking and we're not spreading around the virus. That is extremely important. There are two strains which have people worried. One is the South African strain, the other is the Brazilian strain. Both emerged independently of each other, but they both have similar mutations which they feel will evade the monoclonal antibodies, and they are worried that the vaccine will be less effective. In other words, the vaccine will still help you. It may cause you to get a little sick, but not very sick from these other strains. But they're not certain of that. In any event, they're at least maybe 1 or 2 iterations away from a virus that could actually evade the vaccine. So these are variants that we do not want to get into our nation. It's one of the reasons why President Biden has extended travel bans, because people may say, well, we already have COVID-19. What's the difference? Well, our strain isn't as bad as the strain in South Africa and Brazil. And one of the things that really disturbed me was that there was a report regarding one of the vaccines made in China called Coronavac. And that initially has been reported to have only a 50% effectiveness against COVID-19. Well, it was tested in Brazil. And so, of course, the question comes up, is the vaccine not as good as the United States vaccines, or is the virus a little stronger? Now, when you say 50% effectiveness, that's not all or none. It means, well, 50% of the people didn't get it that would have, but the other 50% maybe got a much milder case than would have gotten if they hadn't had the vaccine. Similar to our current vaccine, when you say 95% effective, that means 95% of the people that would have gotten the virus didn't, but the other 5% didn't get as sick. In the initial trials, from what I understand, only one person got severely sick, and that's out of over 30,000 individuals. So vaccines do appear to be very effective, both with the strain that we have now, and they'll provide at least some protection in the eventuality that you get another strain coming from overseas. But we want to stop that.
Dr. Kevin Kavanagh, thank you so much.
All right. Thank you, Jack.